the notion here is that we'll use small doses of better tolerated chemotherapy for this older population, namely low-dose cytarabine, to reduce the leukemic burden, and then use the actinium-labeled antibody to eliminate any residual disease. And so that's the study that we're doing. And so far, 13 patients have been treated. We've seen that the side effects are pretty typical of any study that's done in acute myeloid leukemia in this population with chemotherapy. Most of the side effects are related to suppression of the immune system, which is also part and parcel of the disease. We've not seen any kidney toxicity, we've not seen any significant liver toxicity, and so it appears to be quite well tolerated. So we've also seen evidence of significant anti-leukemic effects. The majority of these patients are having blast reductions during their first cycle of treatment, something that's actually quite unusual with low-dose cytarabine alone. It typically takes about 3 cycles to achieve a maximal benefit with the chemotherapy alone. So here we're seeing these kinds of effects after 1 cycle. And among the 12 patients who've been evaluated so far for response, we've seen a quarter of them have remissions. And so this is also something that's quite unusual for a phase 1 study, because at this point we haven't even identified the best dose to give. And so we're continuing to escalate the dose of the radiation to find the highest dose that's safe to give. And then we'll proceed with a phase 2 study where the primary endpoint will be response and overall survival, as well as progression-free survival. So we're very excited about these results, and we think this could really play an important role in treating a devastating disease in a population that really does not have any good options at this point.